Hello.
Hello, everyone.
We are waiting on you guys to come into the room and chat with us about Your Health is Lit. We are so excited to finally have this project launched. Okay, so we know a lot of people, it's Friday at 8:30. Like, people are out here living their lives, their best lives.
So we want you to come
We
join us.
want you to come join. We want you to watch. So we're going to shout out to our replay crew because we know you're going to go back and watch this because you want to know what this is all about. So we're going to get started. We're going to introduce ourselves. I'm Charlotte Walker. I am a pediatric nurse practitioner, aka the PDNP. And I'm going to let my...
Hi, my name is Donna Williams. I am a certified health education specialist. I have my master's in public health, and I am a health coach.
Yes, so Donna is like one of my really good friends. And a couple of months ago, we were talking about health, what our people needed in our community, and how we wanted to get involved. And so we decided to create a program to where we can come out and talk about health literacy in a place that's comfortable for us, meaning like Black and brown people, because we know often in our clinical specialties, like I know me being a nurse practitioner, I have patients all the time coming in, and I know that there are families that may still have questions, may have questions about how things work, and I don't have the opportunity to sit and spend as much time with them as possible. So our solution was Your Health is Lit, because we promote health literacy. Your health is lit. It's important to sustain who you are and your health and your healthcare and being knowledgeable about it. Our tagline that nobody should know you better than you means that you shouldn't be asking me what meds you're taking and why. You should know that because you have to be a barrier to protect yourself and advocate for yourself and advocate for your family member.
And this is the reason why we wanted to bring this platform to you guys. And this is the reason why I can relate to Charlotte, because as being a health coach, a lot of times what I was seeing was that my patients were not compliant with their care plans. They were going to the hospitals, coming home, going right back to the hospital, and they weren't managing their chronic conditions. And oftentimes it was something as little as they didn't know how to take their medications. They didn't have the access to get the medications. They didn't know any of the information about how to manage their diabetes, what they should be eating. So this is something that we want to bring to our community to help our community out, because your health is your wealth.
Exactly. We do have a couple of ground rules, right? Because with every good thing, there are some rules. So we only have 5. The first thing is definitely like the posts in the group. We want to keep it health related, medical or health related, some form or fashion. Feel free to post, ask questions. If I can't answer the question, Donna will hop on and answer the question. We have a great team of people working behind the scenes, nurses. We have physicians that we're working with to come on and answer questions and to really like provide health promotion in our community. We also want this to be a positive environment, so there's no such thing as a dumb question. Keep it positive. We don't want you like calling people out of names, bashing people, anything like that. My favorite rule is to keep it reputable. We don't want to share misinformation. And the reason that we think it's so vital to bring this platform is because everything that you read online is not the truth.
Definitely.
Oh my gosh, like stop sharing stuff from websites that are made up. No. So we are definitely looking to be a resource, in our community to where we are sharing reputable information, meaning that there is science behind it to prove a thing or to disprove a thing. We want it to be reputable. We want to share accurate information, and we want to do this in excellence.
So we're not using Wikipedia.
Wikipedia is a no-go. It's a no-go. No Wikipedia. Wikipedia is not a reputable source. It's not. Some of these websites, because you can post anything online. One of the biggest things that I have found that every little bit of information that you share one person shares it and the next person shares it, and we live in this generation where a thing will like literally go out of control. It's like, that's not even the truth. Case in point, Mr. Vaccines cause autism. I'm about to come for this doctor. Because one, there's no science proving that. There's so much research proving the exact opposite. And now people don't know that that physician lost his license and is in prison. He's no longer a doctor. And I meet so many people that read something on Google, or they're a part of a group where they're basing decisions to where their child, for me working in pediatrics, their child is at risk for all of these diseases. I work, we live in Tampa. Hey, Tampa, Florida. And one of our counties, the county that I work in, we have a measles outbreak. And people are like, oh, it's just the measles. You know, my grandma had that, this, that, and the other. But there are long-term effects to these diseases. Why would you want your child to suffer through a disease that they don't have to? There's a vaccine for that. Measles can cause, like, there's a child who's deaf. Like, I've encountered a child who had the measles, and now they're deaf. And that's a long-term permanent thing for something that could have been prevented. There was a story out about a child who got the chickenpox at 11 months old and had a stroke. Chickenpox is something that we can vaccinate and we can protect these children against. So the vaccine thing, I'm here for it, because we're going to stop not promoting health and things that are proven. So speaking of promotion, rule number 4, no self-promotion. Please, y'all. This isn't where you come in to sell your It Works.
Flat tummy tea. We're not selling it. We're not selling it.
Exactly. This is not the place. If somebody reaches out to you about it, that's fine. But don't like, oh, inbox me for details if you want to make money. No, block, delete. You're gonna get deleted. Sorry, this is not what we're about. We're not about self-promotion. This is a group of giving. So we're here to give information. We're here to give advice, share stories. That's what this is about. So Miss or Mr., because either one, like Mr. Inbox me for more details. I'm here for you. I will block you, and I will not think twice about it. And the last thing, please do not post any protected health information. Don't like take a picture of your pills and post it in a group that has your name, your date of birth, your address. No. If you have a question about a medication, if you have a question about anything, make sure that you're keeping yourself protected. This is still the internet. So we're
not trying to violate HIPAA.
Yeah, HIPAA. I was like HIPAA. If you work in healthcare, you know that HIPAA is a big thing. So please do not share names, date of birth, social security, address. You can say, look, I have high blood pressure and this, I've taken this medication. What should I know about this medication? We're here for that. That's what we're here for. We'll get you an answer. If you are like sick though, and you're like, hey, my child has a runny nose, I'm going to tell you to go see your physician, your pediatrician. I am not here to diagnose or treat patients. I am here to provide health education in the service. So
definitely, and we're not here to tell you what to do. We can only give you the information and educate you, which is what we want to do. Right.
So our focus and our goal is health education. We have so many exciting things in the works. We're looking to get people up and moving. I'm currently reaching out to Fitbit right now to see if we can get a sponsorship through them to get everybody in our group Fitbit so we can join start a Fitbit group together where we're all getting active. We definitely want to be a part of the change. So recently, people who are close to me know that I started getting up at 4 a.m. to go to the gym because I want to practice what I preach. I want to make sure that I'm being healthy. I'm out here being active at least 30 minutes a day because I can't get on here in good faith and tell you to do something that I'm not doing. So a lot of people who are looking to lose weight, we're here together. Absolutely here. Not here for the fad diets, but we'll talk about that. Our next upcoming video is going to address breastfeeding and the stigma in the Black community. we find a lot of people, especially me being in pediatrics, people are like, oh, it's nasty. What? No. So we have Mrs. Eve C. Brown, our authenticity empowerment strategist. She's out here. She's going to come on and do a live video with us. She's also a postpartum nurse. That's how she's qualified. And we are just so excited to have her and all of the other just leaders in our community that are willing to donate their time and are really getting behind the movement. And then Donna.
So next month we have sickle cell. We're going to talk about sickle cell, and we have someone very special who's going to be talking about sickle cell. She's so passionate about it. Her name is Dr. Tamia Austin. She's the executive director of the As One Foundation, and I've had the pleasure to know Tamia through the public health program at FAMU. Shout out to FAMU Rattlers. And she's so passionate about sickle cell, and I just cannot wait for her to come on and share that information. It's a topic that is not really talked about a lot, and it definitely needs to be talked about. So I'm just so excited for her to come on. And even me, there's so much for me to learn about sickle cell because I have the sickle cell trait. So I'm just so excited for her to come on and share that piece of information. It's going to be great. So I definitely encourage everyone to definitely don't miss that segment. And even the breastfeeding segment, everything is going to be phenomenal.
Yes, we have so many things. We have physicians, neonatologists, oncologists, dental hygienists, so many people that are just going to come on and share their story, share their gifts, share their knowledge, and just be a part of the group. And we're so excited about it. We have so many upcoming topic events. Anything that you want to talk about, we will talk about it. And if we don't, email us. We have an email, if you look in the description, admin@yourhealthislit.com. Email us your questions, comments, concerns, something that you want to know about, something that you don't want to share in the group, but you want to talk about, and we will definitely address the needs. We're here for the community, and so it's something that we want to make sure that you're engaged with. We don't want to sit and talk to ourselves. We know these things. So we definitely want to make sure that we're keeping you guys engaged. Donna has an awesome list of upcoming topics that she's going to share with us.
So one of the topics we're going to be talking about is stigma of mental health. I think that is a topic that is so not talked about, and I think we just need to address it. Do you want to say something about it?
Yeah. So, to me personally, I feel like mental health is one of those things that we feel like doesn't exist, right? We both love Jesus. We actually met. No, because if it's we both love Jesus, we actually met in a prayer group. Mm-hmm. But there are doctors in place and medication in place. Yes. You can't pray your way schizophrenia. God can do anything, but He also gives us wisdom to seek help and counseling. And we just want to make sure that we're addressing the stigma of mental health in our community. We're also going to be talking about health is wealth. Mm-hmm. And I'm actually going to be giving the presentation. What? There are so many insurance companies that will pay you money to take care of yourself. Who doesn't love free money? I love free money. So I'm definitely, that's Target money. So I definitely want to share that information about how you can get paid to take care of yourself. It's something that you do every day. You should want to do it. And if you don't want to do it, money is always a great incentive. We're going to be talking about breast cancer awareness. We have some great stories to share with you guys. We have a really good friend of mine who's going to come on. She's a breast cancer survivor. Breast cancer to me is something that is super, super personal, super special. Earlier this year, I lost my grandmother to breast cancer. And so it's super personal to me. I love my Gigi. And so I'm just so ready for October to come because I know that she is going to be watching. She's going to be so proud, just us educating the masses about breast cancer.
We're going to have to do the walk.
Well, you're going to have to do, we will be at the walk. We're going to get everybody together, get out, do the walk. We'll have a team, and I'm just so excited to meet everybody and just encourage people to get out and get active and get moving.
Next topic, what we're going to be talking about and addressing is human trafficking. I feel like this is something important. It's happening right now in Tampa, Florida, and a lot of individuals don't even know about it, and it's happening around the world. And a lot of people are so afraid to talk about human trafficking, and it's something very serious, and it's something that needs to be addressed. We need to know the warning signs, what to look out for when it comes to human trafficking. There's places in your neighborhood that you wouldn't even know that is involved in human trafficking. So that's something that we want to address for sure.
Yeah. We're going to talk about the use of ER versus urgent care. You want to know why you're sitting in the ER for 8 hours? Because it's not an emergency. So we're going to help you guys probably play a little game with that.
Go to your PCP.
You guys. Yes.
Yes. I push that every day to my patients.
Yes.
The hospital is not an ER. Please call your primary doctor first, or
yes.
go to your PCP, because that is what your PCP is for.
Yes, if you have an ear infection, even though little Johnny has been crying all night, and I know you really want this addressed, somebody's having a heart attack, and that's why you're sitting for 8 hours waiting. So even if your primary care physician is closed or they don't have after hours, go to urgent care. You should always go to urgent care before you go to the ER. If the urgent care center sends you to the ER, then it's an emergency. But PCP first, then urgent care, then the ER. The ER is not the go-to thing.
ER is not your primary doctor.
No, they are not.
Sorry.
It's so crazy. We're also going to be talking about like the disconnect and the mistrust that we see as healthcare providers in the African American community between African Americans and healthcare workers, and just kind of talk about that and try to find out what things we can do.
I have so many stories about that one.
Yeah.
With my African American patients.
Yes.
When they see me, they're more open to me
Yes.
and like to open up to me and
Yeah.
talk to me.
Yeah.
So I have a lot of good stories about that.
The company that I work for is amazing. Let's start with that. But I have been strategically placed at the center that I'm going to be serving because of the patient population, and they know that I'm going to be well received, aka people are going to listen to me because we look alike, and sometimes it's hard for us as a community to entrust that everybody that we see has our best interest. There have been so many things like the Tuskegee experiment and so many things throughout history that have caused this disconnect and this mistrust between our community and healthcare. And so because I'm a part of both communities, I'm here to bridge the gap. Yep.
Next one is going to be access to care.
Yeah.
We're definitely going to talk about that.
Yes.
I deal with a population of individuals who are low income, I would say. So they have limited access to certain things such as medications. A lot of times at my job, I see a lot of patients who cannot afford their medications. They don't have the access to the proper care. So that's also a disconnect. So it's something that we need to address also.
Yes. Also, we're going to talk about HIV/AIDS. We have a couple of people in our community who are actively working in the field. They advocate for HIV/AIDS education. They want to break the stigma. They want you to get tested. Like, please go get tested.
That's a very important one.
Yeah, like HIV/AIDS is affecting our community at an alarming rate, and people don't want to talk about it. But we're here to talk about it.
And especially our African American women, it's affecting us a lot. And so we definitely want to change that. That's why we encourage protect yourself.
Yeah. Yes.
Know your status.
Yeah.
And don't just think because you look at someone and you assume that automatically
they're fine.
They're fine. Because you don't know.
Yeah.
How do you know that?
I recently moved from St. Louis a couple years ago, and there was a story of a man. He was like a popular. I don't know why he was popular. I think he was a drug dealer. I think he was a drug dealer, and his name was Boss Man. Mm-hmm. And he was purposefully infecting women with HIV. Like, that happens. And because he had money, he had status, nobody thought that would happen. It's a legit thing. Look it up. That's something you can Google and it will pop up. It's a real case. And just to hear stories like that, I have a really good friend of mine who works in an HIV advocacy center, and the stories, they're heartbreaking. And there's no reason for you not to have the information and for you to understand what's going on. Finally, another thing, and we have so many more topics, but we're just trying to like, tell you what to expect coming up. Police brutality as a health disparity.
Big.
That's affecting us. So we want to just talk about it, as from the healthcare standpoint, what things we're addressing, and how to better move as a community and what things that we can do. We're here for solution. For sure. We want to give you access to information. We want to give you solution, and we want to help. All of these things we are doing for the very, very low price of free $99.
And we want this to be a fun group. We want everyone to be
fun,
involved.
engaged. This isn't serious. I have to be serious at work a lot.
Yeah.
It's serious, but this is an open conversation. So when we're on live talking to you, we want you guys to engage with us. We want to engage with you. You can definitely follow me on the PDNP. On my PDNP page, I'm a pediatric nurse practitioner, so it's all about kids and kid health. So this is my outlet to talk about what I know about adults. But I love kids. I do all things kids, babies. I was a NICU nurse. We're going to talk about prematurity in our community. That's a high rate. We have one of the highest infant death rates in our African American community. So our babies are dying, and we're going to talk about why. Put your kids on their back to sleep. Thank you.
I have to make my page, by the way.
Yes.
So I'm the public health queen. Have my master's in public health, certified health education specialist. Background is in health education. I'm all about preventative care, health education, going out in the community, doing that community work. I love public health. I think that is a field that's not talked about a lot, but in reality, public health is all around us. Anything you could think of deals with public health.
Yes.
So I'm definitely bringing that public health side to everything. And I definitely hope that you enjoy it.
Yes, we are so excited just to get on, move forward with you guys. Our next talk is coming up. Yes, I want to say Tuesday. Yeah. Don't quote me. Check the event calendar, okay? And it will be me talking about immunizations, and I'm here for the shenanigans. Just talking about immunizations, what they are, what you should know. And we're going to get ready to wrap up.
Survey.
Yes, a couple of things. Yes, I was going to say a couple of things that we have for you guys to do. So in the meantime, until we meet again, your Health is Lit crew, we have to come up with a name for our followers and our group members.
Yeah.
Give us your name suggestions in the comments. If we pick your name, we got a gift for you.
Please share our page.
Yes, share your friends, share with your friends. This is something that we've worked so hard on. We're so excited for it to finally launch. God has just really, really blessed us and led us to do things, and people are just so willing to jump in and help. And so we're so grateful for that.
And definitely for connecting us.
Yes, and for connecting us. Okay, divine appointments. So we have a couple things for you to do. If you look under the units, every month there's a national health observance. So August, aside from it being a national holiday on Monday, my birthday was on Monday. Okay,
Happy birthday.
Thank you. Aside from it being a national holiday for me, we have national health observances. So the reasons we're talking about vaccines so much this month is because it's National Vaccine Advocacy Month. Also National Breastfeeding Advocacy Month. So a lot of the stuff that we're doing is based on some needs that we see in the community, and as well as it being a national observance. So we have units for you to complete. The first one we need everybody to go complete is take a look in the group. You know what we're about. Give us your feedback, and we honestly, we read the feedback. We want to be better. We want to move in excellence. So please take a couple minutes, do the Survey Monkey, give us your honest opinions. We're here for constructive criticism and things that you need and that we need in our community. This isn't about our feelings. This is about us making sure that we are providing a service to you guys. So please take the quiz. The program assessment quiz just tells us about you, and you can give your feedback to us. We have units on like vaccines, safe sleep, all of that stuff we're currently building, but you can go through and get some more in-depth information. Excuse me, this month the unit is about vaccines. Just talking about the different schedules, a lot of info, like infographics, so things that are easy for you to digest. Health literacy, and the reason our program is called Your Health is Lit. It's really, so we have, people always ask me, like, what's up with the parentheses? Because it's kind of a twofold name. Why our health is lit? Like, why? Because we're great. No, but it is. And then your health is lit. We want you to take responsibility. So we're here to explain why our health is lit, and we want you to know that your health is lit.
We want to empower you to take control of your health.
Yeah.
You only have one body.
Right. So that's why the name is what it is. We're promoting health literacy. We want you to understand what is going on with you, and to be able to share that information with your family members. Me being in the position that I have been able to literally serve my family in ways that I cannot even explain. So I'm grateful because I've caught mistakes. Like, I've caught mistakes, and I've been able to kind of interject and intercede, and I love being able to just be that for my family. And so I want to empower you guys to be able to do the same thing.
I agree.
Yes. So
I'm definitely blessed with the family too. My family has a background in healthcare, but it's always good to be able to go to my family and ask questions. We have a pharmacist, a nurse, social worker, public health, and it's always good for them to come to me and ask me questions. So, that's also a great thing. And also for me, just going out in my community when we're having like health fairs, being able to give that information to your community, being able to give back, which is a reason for me why I went to school, so I can be able to empower others and share my knowledge. Knowledge is powerless if you're not sharing that with anyone.
Yes.
That's what we want to do.
Yes. The Bible says that people die for lack of knowledge. Literally, we are dying for lack of knowledge. African Americans, when you do research and we do research, we are dying from diabetes, hypertension, stroke, heart disease. Our babies are dying. We have a high infant mortality rate. There are so many things, and a lot of them are preventable. A lot of them are things that are like deeply rooted in our culture.
Lifestyle choices. We have to be aware of those lifestyle choices. Nutrition, exercising. Even if you exercise for 30 minutes a day, do something. Also, getting sleep, rest.
Yes. We need to talk about that. Team No Sleep is stupid. Team No Sleep is so dumb. You need sleep. That's how your body re-energizes. And we'll have somebody come on and talk about that. We do not know everything. Let's start with that, okay? But we are connected to people who have the answers to things that we don't know. And so we definitely have, we have an oncologist, a neonatologist, dental hygienist. We have so many people that are going to come on and just share with you guys. So we are so excited. We are happy to see we have 5 people. What's up, 5 people? Yes. We are excited to just work with you guys, serve you guys, and we are here. So again, check out the units. Please do the Survey Monkey, and then you can always email us at admin@yourhealthislit.com. And we are so excited. We will hop back on at our next live. Until then, we will see you guys.
Bye.